I think we've addressed quite a few of the practical challenges for electrophysiologists, as well as the latest developments. Would anyone like to add any summaries? Professor Rico, would you like to?
Well, why you look at me? I mean,
you're to my left.
You are the president.
Yeah.
No, I mean this has been, I think, is a very valuable meeting, and also a very nice setting you created, because we I think addressed many clinical relevant and daily relevant issues. We covered, obviously, the part related to the service. We covered about the referral of patients to different therapies, which is one side AF, the other one was devices. I think we discussed at length the good outcome of AF ablation, and we balanced, I think, also the potential downsides of a therapy, and also putting in the right frame that the most important thing is really to find or to discuss with the patients the outcome, and to try with him to find a consensus on what will be for him the best therapy solution. I think that is the most important one. So personalized, I think therapy is probably the common for all these discussion, going from pacing to CRT to ICD to ablation. And the other one is obviously related to the fact that the electrophysiology community is becoming more and more visible in the cardiology community, and because of that, we need a better interaction with the cardiology and general referral physicians. So this is very, very important, and probably is very much nation specific, healthcare system specific on how you create the interaction, but the continuous change, and then always bringing the positive side of a therapy, at the same time also highlighting that for some therapy we do have a curative therapy. In some other cases, probably a palliative therapy, as we have in oncology. And as in oncology, the therapy are extremely well accepted, well reimbursed as well, because we also acknowledge the fact that reimbursement is a major limiting factor. But again, if we do accept the fact that oncology is worth to be reimbursed, despite the fact that you are gaining just a few months of life, I think we should also probably accept the fact that even gaining few months of better quality of life is probably worth, or as worth as to be paid and to reimbursed. That will be my personal conclusion of that.
I think that's fair. Time for one more addition, or are you happy to close?
Richard, you have been always very positive, I think, with our remarks, and I think it's the right one.
Well, I think that an indication of how far we have yet to go was that in the British Medical Journal 2 weeks ago, there was an editorial being very critical of the interaction between arrhythmia and the industry, making the point that most advances have been driven by the drug companies, which is completely untrue. All of the advances in arrhythmia have been driven by the patients and the physicians, and actually the drug companies have been very late to the table. But it is a testament to how far we have to go that the person that they asked to advise them on that was a general cardiologist. So they didn't actually seek the opinion of electrophysiology. So what we want to do is to have patients have access to specialist care, and editors of the BMJ to have access to specialist information before they make comment.
Good point. I hope you've responded to the editorial.
We have, yeah.